in a moment saying that this meeting is being recorded. We're doing this so we can make the full video available to all health department staff in the next Health Happens newsletter. If you're uncomfortable being part of a recording, please log off and reach out to healthhappens@phila.gov to submit a question if you have one. We'll either answer it today or I'll follow up with you tomorrow. Now, back to the topic at hand. Welcome to the first Health Department Town Hall of the Parker administration. As with every mayoral transition, some things have changed, and we anticipate that will continue for a little bit. But we'll get to all of that shortly. In the meantime, as a reminder, we hold these town halls 4 times a year and switch off holding them during the day and during the evening, so everyone gets a chance to participate. For folks who haven't been to one of these yet, we'll start off with a quick presentation about how things are going in the department, and then open up to questions from you. Today will be Interim Health Commissioner Dr. Frank Franklin's first time leading one of these town halls. I'm sure I don't have to tell all of you to take it easy on him today. That's just a joke. You can come after him a little bit. Dr. Franklin's smiling for folks who can't see that. In addition to Dr. Franklin, we're joined today by several other important members of the health department that may be assisting us today. Now remember, the most important part of the town hall is you. We're here to listen to you, your comments, your concerns, your questions. If you've got a brilliant idea, something doesn't seem right, or you'd like to learn more about something going on, now is the perfect time to ask. So my recommendation is to start thinking about what you'd like to ask the commissioner right now, so you're ready to go once we get to the Q&A section. You can submit your questions in 2 different ways. First, you can do it using the chat function on your Zoom client. If you're on a computer or on your phone, there should be a button at the bottom of the Zoom program that says chat. Click on that, and a window should open up allowing you to put your question in there. We'll read them off in the order that we receive them. Or if you'd rather, you can send us an email at healthhappens@phila.gov. I'll read the questions, and one or more of us will walk through an answer. If we don't know the answer, we'll say so, and we'll follow up via email. As I said before, we're recording today's proceedings, and we'll make that video available in the March edition of the Health Happens newsletter. Before I turn it over to Dr. Franklin, I want to take a moment to plug our Health Happens program. You're already familiar with the newsletter that comes out every month. We need your help to make that a useful newsletter. If you're working on something interesting, or think there's a topic that we should highlight, or someone won an award, or there's an event your division is holding, or really anything you think that others in the health department might find interesting, email it to healthhappens@phila.gov, and we'll work to get it in. That email, however, is not just for the newsletter. That's the designated place for folks to submit comments, questions, and suggestions to the health commissioner's office. We take all of those suggestions seriously and highly encourage you to reach out. Another important thing to note is that if you don't know, we also have a brand new intranet website. This is different than the internet website. This is just for us here in the health department. It's been completely revamped and overhauled to include all of the most important information about working in the health department that you need to know. You can visit it by typing phila.city into your browser address bar and look for a health department link. If you're not on the city network or on VPN, you may have to log in with your computer password. I strongly encourage you to check out the intranet and all the things that are available to you there. All right, finally, after all that, I'm going to turn things over to Dr. Franklin. As I said, he's going to take a few moments and introduce himself to you all, and then once he's finished, we'll go over to Q&A. Thank you very much. Dr. Franklin, the floor is all yours.
Thanks a lot, Jim. I am going to echo your sentiments of making sure that everyone takes it a little easy on me. And since I can't get out of the record, I don't like recording, but I don't think I can opt out, right? So
no, you've got to be here.
All right. Good morning, everyone. It's a pleasure to be here. As Jim mentioned, this is the first town hall meeting in the Park administration, and my first time leading one of these town hall meetings as the interim commissioner. So I'm humbled, and I'm looking forward to the opportunity to interact with you all today and moving forward as we sort of traverse a lot of the changes happening in the city. I thought I would open up and give you guys a little bit of background on me, a little less about my professional background and probably professional training. I think you all know I probably went to school a long time and had a lot of training here and there. But I wanted to give you guys a little background on my personal narrative as being someone from Philadelphia and being in this role as the commissioner. And it's a full circle story. I actually got into public health because of my experiences here in Philadelphia. I'm a native of Philadelphia. I grew up in 3 different parts of the city in Philadelphia: North Philadelphia, around 23rd, 28th and Berks. I grew up in West Oak Lane, and I also grew up in Mount Airy. I got into public health because I was interested in violence in urban environments or urban health. And growing up in Philly, growing up during the crack epidemic, I experienced, or my neighborhoods and my family and friends, we experienced a lot of the negative consequences and violence associated with the epidemic. Had the unfortunate experience of losing friends during my childhood, as well as, actually playing outside in the streets and seeing people or having friends get shot or shot at. But I had this firm belief in Philadelphia, and the belief that against the narrative or different narrative that African Americans or people of color were actually inherently violent. So that was something that struck me and motivated me to sort of pursue my career in violence and public health. I actually volunteered with the health department many years ago. I'm not going to give you all the years because that might give away my age. When I was like 7 when I started this, but actually I was working at a lab here at University of Pennsylvania. At one point I thought I was going to be an immunologist, but I decided to go into epidemiology instead. Well, while I was doing that, I volunteered at the health department with the then Deputy Health Commissioner, Dr. Chuck Woody Anwachi Saunders. I volunteered about 15, 20 hours a week working on one of her anti-violence programs. She has since, at that time, she became a mentor and has remained a mentor with me over the last 20 or 30 years, and has actually been very instrumental in guiding my hand in public health. So when I had the opportunity to become the deputy commissioner, it was full circle for me because, again, she was the deputy commissioner that I volunteered with. So it's like the hometown guy does well or lives out this sort of circle over a 30-year period from volunteering with the health department to actually working with the health department. I've had the opportunity to work in a lot of health departments across the country, various levels, whether it was state, federal, or county, but nothing pleases me more to be here in Philadelphia because it is home for me. So that's sort of the story, how I got into public health, how I got here. I was in the West Coast before I came here. I was in Portland, Seattle, doing work at the Multnomah County Health Department as their principal epidemiologist. So when this opportunity came up, it was perfect timing. So I came back from the West Coast, about 5 hours flight, and about, I don't know how many hours driving, but I just want to let you know, I appreciate the work that you guys do. People ask me, sort of how long am I staying? Not even as I had become the interim commissioner, but just in general. And I can honestly say, this is where I want to stay. And I'm happy to work with you all and happy to learn from you all, and looking forward to moving the department to bigger and better spaces and continue to build on the things that we have already started since my tenure, the things that you guys already started before I got here. So that's my spiel on me. And now I wanted to move into some short-term goals and objectives, just some of the things I've been thinking about as I have had the opportunity to sit in the chair as a commissioner. Sort of 3 things that I've been thinking about in the short term, and perhaps short to medium, depending on how things develop with the mayoral transition. One thing that's important to me is to try to maintain a degree of continuity for the department, for the staff, and for the individuals I work with. This sort of happened, I guess, literally overnight for me. I've had a lot of help with the executive team, also help with Maya and Kelson, who are executive special assistants for the commissioner. They've become my handlers in a way, which I laugh about that. But, as they try to work with me to get my calendar going, one thing that's been important for me is not to sort of shift my meetings or the meetings that Dr. Bedical may have had with people internally in particular, because I want people to realize that I'm trying to bring some level of stability and gradually make the changes as the facts change on the ground or as the facts arise on the ground. Maintain a degree of continuity in the work that we're doing, the work that we've already been doing prior to the mayor administration. Although we may not necessarily take on any new initiatives in this interim period, or as the mayor, or until the mayor's transition becomes a little bit more less fluid, we'll say that. So maintain continuity with the work that we're doing, with the meetings, with the projects, and then move forward as we have always been, as we have done prior to the new mayor coming on board. I want to move some current initiatives forward. Again, the goal is not to stop anything that we've already started prior to the new mayoral administration. A lot of the projects that Dr. Bedical has already started, I'd like to continue those projects. So I don't want anyone to feel as though their role, their value, their contributions, or their efforts are no longer important or no longer have the value or currency to the work of the department, just because we are in a transition with a new mayoral administration. The third area for me that's always been important, even when I came on board, is to make sure that we have continue and develop our organizational health and well-being in terms of our programmatic operations and administrative operations. And that's a big bucket, and maybe that can come out more in the question and answer period. But I think those three things are important to make sure that we can stable the ship or keep the ship stable and pivot as we need to as a department. That was a mouthful.
Thank you very much, Dr. Franklin. I have to tell you, we'll save these chats. You got a few very nice messages here in the chat from folks welcoming you and happy to hear your backstory. I think it's important for folks to realize that we are not just a nameless, faceless health commissioner's office. We have a name and a face and a background and dedication to helping keep people safe and happy. So thank you very much for that background. I do want to remind folks that they can submit questions to us. We haven't got any just yet, but I think everybody was a little bit enthralled with Dr. Franklin going through the background. So I will start things off for us with a question that I've had, is if we could have, over the last couple of town halls, we've heard Dr. Bedical give us updates on the prospect of having some new health centers in the Northeast. And I was wondering if you could just sort of update everybody on where that process stands right now.
Yes, the health centers are moving and going forward. Right now, we're in the stage of having a couple more community meetings with the various neighborhoods who are impacted by the centers directly or indirectly, just to make sure that we've heard all the voices, taken into consideration some things that maybe we have missed, or as things develop with new priorities for the city. But the community meetings have been going great. I've had the opportunity to lean on Deputy Commissioner Dr. Pollock and Ravel Nelson, as well as Sarah Enos, Chief of Staff, who they both have really led these community meetings and made it really easy for me. So I thank you both, Sarah and Pollock, as I lean into this. But we've gotten a lot of support. There's always a couple people who still have concerns or may be less appreciative of the health centers, but it's one of my priorities as a health department to ensure that we have linkages to primary care and we address the needs where they arise, whether they're North Philly, Northeast, Southwest Philly. We want to bring health to the people who aren't impacted. So right now, I think we have 1 or 2 meetings scheduled, or to be determined in terms of the scheduling. And then I think we're going to move forward and work with the council members to see if we can get the zoning established and get the buildings built.
That's great news, especially for the folks who live in the Northeast and all of the new communities that are burgeoning up there. This is a great resource. So I echo your sentiments. Thank you very much to Sarah and Dr. Ravel Nelson. We have our first question here, Dr. Franklin. I'll read it off to you. Welcome, Dr. Franklin. What is being done to ensure that a harm reduction approach is maintained when working to help those with substance use issues in the Kensington area? There are valuable agencies who provide assistance to individuals there.
Read the first part of the question for me again, Jim.
Sure.
Was the word maintain? Was that in there?
What is being done to ensure that a harm reduction approach is maintained when working to help
Okay.
those with substance use issues in Kensington?
Well, let me open up. I don't think the goal is, or at least from my early conversation with the mayor's office, the goal is not to remove our harm reduction services. I think the goal is to keep our harm reduction strategies in place and to add other strategies, because we all know that not one strategy is ever the solution. So in supplementing the harm reduction strategies is not to remove or to eliminate the harm reduction strategy. So we're going to keep the harm reduction strategies. They may look a little different as we add other strategies in addition to the harm reduction strategies. But my conversation with the mayor and managing director's office, they're not there to remove the harm reduction services. I think they just want to build out and build a more comprehensive, robust set of strategies.
Thank you very much, Dr. Franklin. In the meantime, we've received another question. Good morning. This is reading the question directly. I am a current city employee with the health department. I started my career with LNI. Within my time with the city, I have dealt with low wages, being bound to live in the city as an employee, and safety concerns. My question is, within the first 90 days of the mayoral transition, one of the first things on the agenda is to transition hybrid employees in. I imagine that is into the office. It works for many of us, and frankly, what has kept some of us here. Is there a plan to discuss with the division's employees the benefits of work from home?
Let me preface with the short answer is yes. No decisions have been made in terms of how the workforce will transition from hybrid, or any modification, what the modifications will be. Right now, the modifications for the workforce really apply to the commissioners and the deputy commissioners, as well as the directors. There is a sort of fundamental plan to work towards having the workforce in the office more frequently, but whether that's 5 days a week or whether that's 3 days a week, those decisions have not been made. So I don't really have any details on that beyond the desire to try to move us back into the office a little bit more frequently. Once I get more of the details from the managing director's office or the mayor's office, there certainly will be opportunity and to have discussions, and they want to have the discussions with the departments as well as the staff before making any final decisions.
Thank you, Dr. Franklin. And I'd love to be able to sort of piggyback on that and let folks know that one of the things that my office is very concerned with is making sure that you all know what's going on as soon as we know what's going on. That's the purpose of the newsletter that comes out every month, but it's also the purpose of those emails that we send in the middle of the month that are just sort of on breaking news topics. And Dr. Franklin and I have had conversations committing to when we learn something and something is firm, you all will be the first to know, is probably the best way to put it, and continue to do that. In the meantime, though, I do encourage folks, if you've got concerns, if you've heard rumors, if you've seen things in the press and you're not sure what that means for you specifically, definitely encourage you to reach out to your supervisor to find out what's rumor and what's real. If you're not sure if that's the best way to go forward, the Health Happens email address is always there. Please send us an email. We are happy to point out, again, what's the difference between rumor and real, and make sure that you have the latest confirmed information. This is a resource that's there for you guys, and we'd love to be able to help. Moving on, Dr. Franklin. This looks like a follow-up question to your return to office question. Would this affect all employees equally, city employees and contractors all the same?
Again, I do not have any details, but nor do I have any information to suggest it would not.
Question that changed the topic a little bit. Are there any specific plans to address health inequities in underserved communities? Resources and access to healthier foods or an appropriate health care question. This seems like a pretty broad question, Dr. Franklin. You can riff a little
That is a broad question. I think we're probably doing that every day. That's an ongoing thing, right? Working with our chief racial equity officer, but more importantly, working with the division directors and the staff here. I think we're always constantly trying to be innovative with how do we center equity better in the work that we do. I know some of the things that I've been working on when I was deputy commissioner that we're going to continue to move forward. And I'm sure there's going to be some other things that I've yet to realize because I'm still learning this role. But for instance, we are working with our community hubs or our resource hubs to maintain the resource hubs. As you know, one of the resource hubs will be relocating. I know there were some rumors at one point in time that we would close down the resource hubs, but that's been something that's been very important to me in terms of making sure that we have an ongoing connection to the communities we serve, or those communities who are often impacted due to social vulnerabilities. So that's been very important to me, and I hope to sort of move that forward, as well as maybe introduce the idea of introducing community health workers into the health department. But a lot of these plans are still sort of forming. But the big answer to your question is yes. What that looks like in different spaces will vary depending on what we're talking about. So I'm happy for some follow-up questions if we can narrow it down a little bit.
Thank you, Dr. Franklin. Tina asks, congratulations, Dr. Franklin. Could you talk about your main priorities when it comes to various public health issues faced by everyday Philadelphians?
Well, I think some of the priorities are, I'm pausing when you say some of the main, like my main priorities. I think, the priorities change depending on what's happening on the street, right? As we all know, we're sort of in this space where COVID-19 and the pandemic has subsided or has become less volatile. And as a city and as a health department, two areas that we will have to face or revisit. I think these areas that I'm about to talk about probably have gotten a little obscured because of the pandemic. One is firearm-related violence in the city or violent crime in general. The second area is looking at opioid-related events or substance use disorders across the city. And as we all know, those two things were always in the background, but the pandemic sort of came and took over all of our priorities. Another issue is also focusing on infectious diseases or outbreaks. We have to pay attention to issues such as the measles, such as mpox. These concerns with these infectious diseases, they're not eradicated yet, and we have to keep our foot on the pedal. So those are kind of three areas that come to mind for me.
Thank you very much, Dr. Franklin. Bernadette actually followed up directly with your question, and she did about 4 minutes ago. Dr. Franklin, how are we / can we maintain that public health is prominently represented in the gun violence prevention agenda being set by the administration? This is one of your priorities. How can we make sure it stays a city priority?
Repeat that question again for me. I'm gonna get you burned out. Repeat that question.
Of course. How are we / can we maintain that public health is prominently represented in the gun violence prevention agenda being set by the administration?
Yes. I'll be honest. When I came on board, I realized that our injury prevention program was fairly new, and I had the opportunity to work with the division director of chronic disease and injury prevention, as well as the program manager for our injury unit, which is Pilar Ocampo and Dr. Kennery Chandriani. I'm working closely with them, and we're working closely together to build out our violence intervention prevention strategies. I've also met with, guys are recording this, I'm gonna forget his name, the new public safety officer last week, and so I'm getting on his agenda to make sure that the mayor's office and the health department are aligned in terms of where we want to go forward with not only the mayor's firearm violence prevention strategy, but also the departments, and making sure that we center the department and leverage the department in a place as a convener, in a place as someone who drives the science and helps shapes the policy. At the same time, supporting the programmatic activities and the boots on the ground. So that's some work I'm looking forward to, because again, as I mentioned, violence and injury is sort of what got me started in public health.
Very good. Changing topics very quickly. Dr. Franklin, can you expound on CDC guidelines regarding COVID-19? There seems to have been some changes made over the last few days regarding 5-day isolation protocols.
Yes, I can. Again, that's a big question, but what I think the goal here, at least after having some of my meetings with CDC last week and late last week and early last week, I guess, and a little bit over the weekend, I think the goal is to sort of really look at respiratory viruses in a collective, and whether it's RSV, whether it's COVID, or whether it's flu. Now that COVID has sort of been repositioned to be similarly more situated with RSV and flu. And by that, I mean, given that we have treatment protocols, given that we have vaccines, along with the other standard protocols in terms of hygiene and keeping social distance, as we sort of have gotten a handle on COVID, it probably seems to make more sense to not necessarily have the isolation in place, particularly if you don't have isolation in place for RSV or isolation in place for flu, right? So the biological or the immunological attributes of the virus hasn't changed, but we've sort of advanced in terms of our ability to mitigate and rehabilitate the impact of COVID.
Excellent. And for folks who maybe haven't heard the details and the background of this question, I apologize for not prefacing Dr. Franklin's response with this. CDC made an announcement last week that their recommendation used to be for people who tested positive, they should isolate for 5 days after testing positive, just to make sure that they're not inadvertently spreading COVID to others. The change the change that was announced was that folks who test positive for COVID should isolate until they're 24 hours post fever or post symptoms, which puts it in line with what basically the recommendation is for people with flu or people with RSV. Boiled down, the suggestion now for people with respiratory virus is if you're sick, stay home. But the thought is that once you've gotten to the point where you're no longer exhibiting symptoms, isolation is no longer needed. So that's the change, and Dr. Franklin got to that from a immunological perspective and sort of gave the medical background of why that's important.
Thank you, Jim. I want to work on that.
We're a team. We're working. We're finishing each other's sentences already. All right, next question. Dr. Franklin, thank you for your time. Are there any larger plans to transition, well, it says PHMC employees, but I imagine this is contractor employees. Are there any larger plans to transition contract employees into civil service positions should they choose to take the benefits and restrictions?
There is no larger plan to sort of transition people or transition contract employees into civil service in terms of, and this is how I'm processing the question. I'm situating the question in terms of whether it's going to be whether that's a compulsory initiative, and it is not. If there are individuals who have an interest in transitioning from a contracting role to a civil service, I think most of that's going to be done on a case-by-case basis.
Got it. So it doesn't look like this is not a requirement that these changes will be made, but for folks
we're not forcing anyone Right.
Got it. So, but for folks who would choose to be able to make that switch, looking for the benefits and aware of the restrictions of any potential restrictions of moving to civil service, that is something that the health department
Yes,
is allowing and is
is
working with.
allowing and very supportive of.
Thank you very much, Jackson. I appreciate that question. Another question, and this one has been echoed in a couple other questions that I will skip over as we get to them. Good morning. It says many of our divisions are challenged for space to accommodate teams. What are some strategies to address space constraints being considered? And I imagine this is in light of the mayor's noise around moving folks back into the office at some level.
Well, there's sort of two responses to that, and I won't put I think Ryan Taylor's on here somewhere, but Ryan has been working. Ryan and Deputy Commissioner Dr. Pollock Raval Nelson have been working tirelessly to sort of transition different divisions, different units to new spaces. Ryan has been working on developing some new spaces for us here within the building and several other buildings. And he probably could, if there's some more specifics, I think he can answer that question a little bit more detailed than I can. But in terms of the larger issue, you're correct. That is one of the factors that we have to take in consideration, and the mayor's office is aware of that. Even if we turned on a dime tomorrow and said everyone back in the office, we wouldn't have space for them. So the department is well aware of that. The mayor's office is well aware of that, which again is one of the factors that they will have to consider and be a little bit more deliberative, or will be deliberative than necessarily making an arbitrary move.
All right. In terms of benefits, next question reads, good morning. Are there plans for SEPTA benefits being offered to contract employees? So for folks who don't know the background to this question, the city announced last year that civil service employees have access to SEPTA cards, SEPTA key cards, and access to the SEPTA network as part of their city benefits. This sounds like it. They're asking if there's any talks about extending this benefit to contract employees as well.
No, not to my knowledge.
But if that changes, Aaron, obviously, this is something that we would communicate to everyone. We communicated pretty broadly to civil service folks, but we would do the same if we did learn of a change. So, TBD. Next question, Dr. Franklin. Are there plans to create more homeless shelters, create more programs to assist the homeless? I know there are plans to clear the encampments in Kensington. What is the plan as far as helping the folks in those encampments?
The plan hasn't developed yet. Again, we just had a meeting last week with the mayor's office, and there is a desire to scale up to the greatest degree possible the services, homeless services, working with Office of working with OHS and all the other departments who are engaged in that space of providing housing and human services for those populations who need it. So the plan has not been fully developed yet, but we are working together, meeting with various departments under the mayor's, I guess, convening authority to develop that plan.
Next question then, in terms of meeting with other partners. Good morning, Dr. Franklin. Welcome to your new role. Would you feel comfortable sharing your perspective on how you see our current working relationship with state and federal government to advance Philadelphia's public health goals? In addition, are there opportunities you see that could strengthen this relationship?
Well, that's a big question. My experience, and this may be, and please, the person who asked the question, you can add more details, but since I've been here, my experience working with the state partners has been pretty good. I had a meeting last week. I keep saying that, right? I've had 1,000 meetings that I normally would not have, but I had a meeting maybe a week or two ago with the State Department, the Pennsylvania Department of Health, and the Secretary of Health, as well as other commissioners or public health directors across Pennsylvania, different counties. And my experience on that call, as well as my experience up to this point has been pretty good. And most of my experience has been up until this point has been centered around, working out relationships with getting data with different departments, supporting other departments at the state level in terms of their grants and vice versa. I think, and the federal partners. The federal partners have been relationships are good as far as I know. So I don't foresee at this point any challenges, but I'm open to a more specific question if the person who's asking has something in mind.
Yeah, well, and then I'll just follow that up, Ryan. I mean, I think this is a great question to send up to your supervisor, and and I think we can help flesh out sort of if there are opportunities that we could help take advantage of. I know a lot of folks, not just yourself, but a lot of folks throughout the department have access to partnerships within different areas of federal and state government. You guys know these folks a lot better than Dr. Franklin or myself. So, I think as opportunities present themselves, and while this question is directed from at Ryan, I think it really applies to anybody. Being able to bubble up those opportunities and those particular challenges to help us get ahead of them and take advantage of them is always welcome. And that's I think the best place to start those places is definitely with your supervisor. I think that would benefit everybody, not just yourselves. So thank you very much for that question, Ryan. Moving on, Dr. Franklin, we continue to get questions. Everybody is very chatty with you today. You're doing a great job. That's the way I'm interpreting it. Tina asks, following up on the issue of gun violence and staff safety. In the last 24 hours alone, there have been 2 fatal incidents involving SEPTA buses. Could you expand on your vision on addressing gun violence as a public health issue, as well as what safety measures can the city or PDPH provide for staff with the latest news around returning to office? So there's 2 questions.
Yeah, there's 2 questions. Two questions there. So
let's start with the first one there. How could you expand on your vision on addressing gun violence as a public health issue?
Yeah, I think one of the opportunities we have in front of us as the health department is to sort of more clearly define what we mean when we say gun violence is a public health issue. Again, those are some of the discussions I've been having with the director of the Chronic Disease Injury Prevention Program. I think we use that term a lot, but I think it's often lost on the broader public on exactly what that means. I know for us, for a health department, again, it falls in sort of 3 particular areas. Our ability to sort of convene collaboratives and partnerships and coalitions on the ground who are actually engaged in the frontline work. Our ability to drive the science and the data to shape the policy for further prevention upstream, to support sort of the larger efforts with our partners across the city, which includes the police department, which includes the mayor's office. So some of the direct activities really involve, in terms of public safety, involve not just the health department, but some of our other partners across the city, partner agencies. The second piece is, I think, more specific, but relates to our employees in particular. Is that sort of what it is?
Yeah.
Now that's a good question. And that is something that we will have to work out with our partners. I know we've had a couple meetings with SEPTA, not on this issue particularly, but on other issues where various city agencies, I think, are all trying to take a look and figure out how do we create the new normal in our city post-pandemic. SEPTA is having their challenges. We are having our challenges as a health department. So we have been in meetings for various projects to try to improve ridership with SEPTA, try to improve safety. And I think the same holds true with our partners in the police department, although I have not spoken with them yet on this issue because many of these plans are still developing. I think what we're hearing right now from the mayor's office in many big cities, we're hearing the drive to get back to the new normal and create a new normal, but the plans for the new normal have not been set in stone yet.
A little more TBD, but this is something, Dr. Franklin, sounds like you're aware of and are starting to have those conversations. Moving on to the next question, Emma asks, good morning. What is the Health Commissioner's Office doing to address staff retention and burnout?
Big question. You guys are good. You guys are good today. Let's see, a couple of things. I have worked with and continue to work with our workforce director on um, improving the options we have as a workforce to take care of ourselves and addressing our well-being. Alicia Wright Lewis has worked tirelessly to put a lot of products in place in terms of health and well-being activities with various gyms and various other venues to support our well-being and support our mental health and things outside of work. And I'll let Alicia sort of expand on that later at another venue. I also realize that we're also working on, and we need to work on our messaging on that a little bit better. So I'm aware of that. Also with retention, as you all know, we've done a couple staff surveys. I think the third one will be coming out in a couple of months or maybe sometime this summer. But we have instituted some changes based upon the surveys. We've gotten good input from Alicia, as well as our Chief Racial Equity Officer, and engaging employees to sort of what we call what's been called I can't think of the term, not an exit interview, but a stay interview. What do we do to sort of understand the people who stay, and how can we continue to build those assets to ensure retention? So not just waiting for a person to leave or to onboard them, but just to make sure that we engage them in the interim.
Thank you, Dr. Franklin. Another question heading back into Kensington. Good morning, Dr. Franklin. Considering one of the mayor's key plans is to, quote, clean up the Kensington area, is the health department also working on a plan to provide services for displaced persons? Assuming there will be a new Kensington community if proper channels are not taken, just wondering what the plan may be. It looks like
Plan
a
is
question
not yet developed.
Okay, I'm sorry.
Yeah, I'm sorry, go ahead.
No, I was just going to distill it down as the health department working on a plan to provide services, and you're saying the plan is not yet developed, but something we're working on.
Right, but the health department is working in collaboration with other agencies who have responsibility in this sector. And I think because it's a Philadelphia issue, I would go as far to say that we all own the issue. We all have room to contribute to resolving it, not just the health department. But the plan for the larger city has not been developed. But as we build that out, and as I work with our director of substance use prevention and harm reduction, Dr. Andrew Best, who's been providing great leadership in this area in terms of his initial thoughts, and we'll be working with other division directors in the department to help sort of formulate our contribution as a department to the larger plan. So more to come on
that. Next question, Stephen asks, I heard something about eliminating the need for college degrees for certain civil service positions. Can you say anything about where we might see this list of adjusted positions? And if not, this is something we can follow up on and get back to folks if that's not top of your head, Dr. Franklin.
Yeah, that isn't top of my head. I will need to get back to you on that.
Steve, we'll reach out with where this is, and actually, this actually is not a bad thing. Once we identify where folks can see what this full list of changed positions is, if it's been released by the mayor's office, we'll send this out to the department so everybody gets a chance to see it. Thank you very much for that question. Next question. This looks like it has to get into space a little bit. Are there resources to purchase portable, quote, call or meeting booths for those working in office who have to take virtual and video meetings? To put into context, the work has changed, and everyone talking on virtual meetings at the same time can be distracting. Not everyone has a door. Is this something that the department has explored or thought about?
Not to my knowledge, this is the first time it's come to my attention, but it's a good point.
Right.
I've seen some of those actually at CDC campus in Atlanta, but I'll have to circle back on that.
Excellent. Thank you very much. Moving on, because the questions are still coming in, and we've got about 11 minutes left. As we have about 11 minutes left, I do want to let folks know, if you please continue to submit questions. If we don't get to them, we will follow up directly via email afterwards. Next question. This looks like it gets back to Kensington once again. Shouldn't there be a plan to assist people before clearing them out? The camps will just pop up again and again if there's no plan in place. Dr. Franklin, I don't want to put words in your mouth, but it sounds like this is sort of still an ongoing conversation that we're involved in. So Stephen, what I'd love to be able to do is, I think we're taking these suggestions and again, Dr. Franklin, I don't want to speak for you, but it sounds like at least these concerns will be represented as part of the health department's conversation. Is that fair?
Yeah, I would agree. And that's a reasonable concern. And it has been and will continue to be taken under consideration.
Another question Yvette asks, there were talks around maybe trying for a 4-day-a-week, 10-hour days for civil service employees. Have there been any conversations regarding that you're aware of?
Not to my knowledge. I think given some of the ideas of the new administration, I would imagine that particular question will be coupled with the larger question of what type of changes can and cannot occur.
Moving on to the next question. Congratulations, Dr. Franklin. Is there a plan to expand resource hubs? And where? I guess we'll start there, and then there's a follow-up question.
I would love to do more of that, actually. I think for me and for the department, the initial goal was to make sure we didn't lose the 5 that we already had. I would love the opportunity to do that. We don't have any plans to do that immediately, but I think it warrants further consideration. We pretty much, the new hub that's opening up, I think next week, or the hub relocation next week. Once the department is clear that we can stabilize and the hubs that we have are in good conditions, I certainly will look into or open to having further conversations about where could we have other hubs and how do we resource other communities.
All right. Well, the second part of that question then gets into where do you see the future of our outreach efforts in the city? The reason I separated them out, this seemed like a very broad question that you might have some thoughts on.
That is a broad question, and I spent a considerable amount of time thinking about that when working with the Chief Racial Equity Office. One of the things that I realized being in public health over the years, and again, as we probably have all heard and maybe even said once or twice, highlighting the need for stronger community engagement and outreach in order to strengthen our ability to do community mobilization. One of the things that we've been working on, I've been sort of thinking about, is how do we make sure that our philosophy around community engagement, our principles and practices are somewhat more consistent within the department when we apply them across various programs. So we're working on that internally. Also working on our ability to strengthen our external relationships. Hopefully, as we move forward in this fiscal year, the goal is to develop some type of community engagement plan adjacent to our work in health equity. So more to come on
that. Thank you. Next question, with respect to COVID-19 safety protocols, will a new city policy statement be issued regarding the elimination of the 5-day isolation? For background, the health department safety team receives notification of positive cases and requests for determination of when an employee can return to work. Basically, does the city intend to follow the CDC guidance?
As far as I know, that is the case. But if that changes, we definitely communicate that to you all. And if any type of rule like that is put forth, that again will have to be driven by the mayor's office with our input, as well as probably other departments' input.
Thank you. Marilyn has a question. I don't know that this fits into our world, but I promise to ask all of these questions. Marilyn asks, any more rehabilitation places for mental health and injection drug use? Anything on the plan? Now, the reason I'm saying that this may be a question more appropriate for Department of Behavioral Health, but if you're aware of any plans by the city to increase access to treatment options.
Not specifically, no, but that I think that question will lie a little bit more. Some of the details on that will lie more with DBIDs, but I really haven't heard one way or the other.
Next question. Have you heard of any plans to change or remove the residency requirement to help retain staff?
No, I have not.
Okay. Moving on, next question. Thank you for sharing your background story, Dr. Franklin. Are there current volunteer opportunities that you're aware of that will allow colleagues to increase their exposure to other areas of public health? So this would be volunteer opportunities within the department, it sounds like, and Lana, if I'm speaking incorrectly, just let me know. Allow us to folks maybe in one particular division to volunteer or spend time in another division to learn what's going on.
That's a great question. I really like that question. I think it's functional mentoring, what it's called, at least that's how I refer to it, is a great opportunity for people to develop other skills and learn what's going on in the larger organization. I have been working with Alicia Wright Lewis, and she has been working on developing a mentoring program for the department, for employees within the department. So more to come on that. I'm hoping that we can stand that up within the next calendar year.
Thank you very much.
No, within this calendar year. Sorry.
Next question that we have. Good morning, Dr. Franklin. Do you plan on visiting different divisions within the department to see firsthand the conditions that employees work under?
I think that's a good idea. Do the divisions want me to come visit?
I'm sure everybody would love the chance to get to meet with Dr. Franklin. Thank you very much, Angela. That's a good question.
Yeah, I'll look into that. I think that's a good idea.
All right. Oh, and we've already gotten comments, people telling you to come chat with them. This one I'm going to ask it, Dr. Franklin, just because I think that it is it's something because I said we would ask all these questions. This may be a question better directly within the division, but to let folks know that this is something that we're talking about. Good morning. Just a question regarding field worker staff safety. I'm a sanitarian. I understand we have to go into the community to inspect various places, but I think it would be safer for us to be allowed to type the reports at the office or from home. Are there any safety measures that field workers can look forward to? And obviously, I don't want to discount the question. If there is anything you're aware of, Dr. Franklin, this may be a question that we have within divisions, but if you're aware.
No, I'm not aware of anything in particular. I do know that there are different categories of field staff, not only in the division from the person who asked the question, but in various other divisions. And each division, each division has their own set of protocols regarding field safety. So there's some variability there. I think for changing or modifying or interrogating some of those protocols would have to start with the division first. And I'm happy to be a part of those conversations and learn more.
Tara has not necessarily a question, but a comment. The greater Northeast is seeing an increase in folks setting up encampments in wooded areas. Dr. Franklin, I'm not sure you're aware that this is something Tara's brought up in a couple of these. So this is definitely a priority. And as you have conversations about what these encampments look like, it's good for you to be aware that this is not just a Kensington issue.
Mm-hmm.
Moving on, next question. Do you foresee plans for PDPH to be ahead of the dire or deadly impact of diseases or viruses upon Philadelphia's most vulnerable communities? So this sounds like it's getting at your question or the comment you made around infectious disease spread, especially things like measles or Mpox.
I know I hate to do this to you again, Jim. Repeat the latter part of the question. Or not.
Of course.
Feels like a big question.
Foresee plans for PDPH to be ahead of the dire or deadly impact of diseases or viruses upon Philadelphia's most vulnerable communities. So, are there any plans
Well,
that are being developed?
that would imply that we're not ahead now. I don't know. I think our but no, there are plans to try to make sure that we stay ahead and be a little bit in front of the curve. There's a lot of great work going on in the Division of Disease Control under the leadership of Dr. Landris Burris, and I'm happy he's here with the department. I know one of the things that at least I've asked about, and we're further exploring, is our ability to expand our wastewater surveillance to make sure that we're aware of things that are coming into the city. Not only in terms of biological exposure, but also in terms of our substance use and illicit drug exposure. So I'm working very closely with the public health lab to see if we can expand our capacity to do wastewater surveillance for drug-related issues, as well as the potential of expanding our ability to detect other things in the water besides COVID. So more to come on that.
Wonderful. I do want to make mention of the time. It is 11 a.m. We have received a couple questions that we're not going to get to, unfortunately. I don't want to keep you guys away from work. We're recording all of those questions. We will keep them, and I promise to reach back out to folks who we didn't get a chance to chat with. I wanted to make one last call and say thank you all very, very much for joining us today. This was by far our best attended town hall. Dr. Franklin, I think, recorded himself very well. And I want to thank you all for the great comments and questions.
Thanks, everyone. This has been great. Thanks. Bye.
Thank you all very much, and please keep an eye out for the recording of this to come out later. Have a good day.